Hello, my name is Dr. Stanley Lang, and this presentation is on how to relieve chronic stress. So when we're talking about how to relieve chronic stress, I'd like to tell you a couple of stories and then get into the how-to. But today I saw two different patients, one very much on the older side of the spectrum, a woman who is very active still, but has a lot of different medical conditions. She's over 75 years old, and she was having essentially panic attacks and hyperventilation syndrome with it. So then I saw a younger man in his teens who was also having hyperventilation symptoms. And he was a little bit panicky from them because he hadn't had them before. He wasn't quite sure what was going on. So I explained to both of them how hyperventilation causes the symptoms that they're having. So hyperventilation basically is when you're breathing too frequently or too deeply with each breath, even if you're not breathing too frequently, so that you are getting rid of more carbon dioxide than you should. And when the carbon dioxide levels drop to a certain level, you start to feel a lot of different symptoms, which we call hyperventilation syndrome. So basically, chronic stress was at the base of both of these patients' problems. So how did they get there? So chronic stress is something that I like to say causes disease physically, but also causes dis-ease mentally and emotionally. So I think that it's actually the source of most of the patients' problems that I see. Even if it's not the cause, it's aggravating them in a huge way. So I'd like to just review some of the things that are causes of chronic stress or contribute to it, because you can't fix it if you don't know that it's contributing. You can't fix the chronic stress if you don't know all the different things that might be contributing. And in my experience, we have contributions coming from all parts of us, which are health. Our health sources are in body, mind, and spirit. And all of these areas can become disturbed and out of balance. And when they are, the result is chronic stress. Now, in the emotional realm, chronic stress is perceived like this. There's a big gap between what I want and what I got. So what I got is called reality. What I want are my expectations. And when that gap is big, when that gap is really big, and especially when it looks like there's no way to bridge the gap, then I experience what we call stress. And that's the emotional process that's going on in chronic stress. Now, the physical aspects of chronic stress are somewhat connected to that reality expectation stuff, because a lot of times we don't have physically what we want, but the contributing causes are our nutritional program, our exercise program, and our rest or lack thereof. So I just want to touch briefly on the nutritional part of it, because those are the ones that a lot of people are not getting at all if they don't understand how it plays a role. The first thing is that we are poisoning our gut, and that messes up how our gut works, and that contributes to our feeling of stress, because when our gut is out of balance from the chemicals that we're getting, then that talks to our brain, which triggers the anxiety stress symptoms that we have. The second thing is that we don't know how to fix our gut with the right probiotic foods, which if we start consuming the right foods, especially if we stop eating the toxins that are killing the good bacteria in our gut, then we can have a lot healthier gut. It will talk to our brain. We will have more peace, and we'll be healthier in a lot of different ways. The third thing is most people are deficient in a lot of different key nutrients, and most people are taking garbage nutritional supplements. Taking the right nutritional supplement can definitely help to restore the balance in the gut and in the whole body. And then the fourth thing is eating in a way that is not triggering inflammation, because when you trigger inflammation, that aggravates the chronic stress response. And this all happens in the brain. So when inflammation increases, the brain produces the chronic stress response through a lot of different complicated chemistry I'm not going to get into. The other area that I mentioned is the spiritual component. Just to briefly touch on the two main areas, chronic unforgiveness, chronic resentment is huge as a source of stress, and then that leads into that little gap between reality expectation that I already mentioned, and then lack of thankfulness, where we focus on criticism all the time instead of thankfulness, is also a big cause of chronic stress. So addressing all of these things will help us to have a minimum amount of stress. Now, can we address them all at once? No, I'm not suggesting that you can, but you can start to address these things one by one. And once you get one area some progress, then you can move on to the next area. And over a period of several weeks and months, you can be a completely changed person, especially if you plug into the right program. So these are the components that lead to the experience of chronic stress, which in both of these patients led to this hyperventilation stuff. So chronic stress was going on under the surface. I won't get all the details of their versions of chronic stress, but it surfaced as hyperventilation syndrome. In your situation, you might be having stomach pain or headaches, or you can't sleep, or poor relationships. There's a lot of different ways that chronic stress manifests itself, but you can heal it, you can fix it, you can manage it, you can relieve it if you know what to do. And so this is a list of the areas where you can start to work. And if you need some help, I've got some resources for you. God bless and have a great day.